Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye. Hello everyone, it's Ashley with Amare, and today we're going to talk about how to properly clean your incisions after plastic surgery. So I know a lot of you guys love using antibacterial soap. That stuff is ruining your skin. So antibacterial soap is usually recommended pre-op for cleaning your body, and sometimes on your post-op care sheet you'll see it on there as well, but they don't tell you when to stop using it. So if you have incisions that are left open, right, those usually start closing within the first 72 hours, the first 3 days. If you are told not to shower because you have drains, things like that, right? So if there's any like wetness, you want to make sure you're using the antibacterial soap because it's meant to dry. That's the point, is for drying. But once you have scabs, once your drains are out, once your incisions are closed, you don't want to be using that stuff anymore. That is what's causing your post-op itch. If your skin is flaking off your body in your garment, number one, that can cause an infection. You have dead skin and then you're in a garment that's trapping moisture. No. Number two, your incisions. If your incisions are having problems closing or if they're cracking, if they're really dry and the skin is peeling away from your incisions and flaking everywhere, you need to stop using the antibacterial soap. So the FDA actually put out a couple years ago a ban on a bunch of ingredients that are in antibacterial soap because triclosan, which is a pesticide, a known pesticide, is in a lot of Dial products. Now, although those products have been pulled off the shelves, they are still available on Amazon and online for purchase. So we are not a fan of Dial, like at all, because of all the chemicals in it, the pesticides, things like that. Dove. There's a pH balance to your skin. So I want you guys to understand something. You are not just, when you take a shower after surgery, let's say you're like 3 weeks post-op, you guys aren't just using this antibacterial stuff on your incisions. You're using it on your whole body. And even 3 weeks post-op, you have a scab covering that incision, covering that hole. You don't need to be using antibacterial anymore. You need to be using something that's going to help with wound healing. So you're using that, you're drying out your skin, and Hibiclens has isopropyl alcohol. So Dr. Richard Brown, the reel is on my Instagram, did a reel talking about isopropyl alcohol and peroxide for wound healing, and it is one of the number one things because it ruins the way that the wound heals and it dries it out and it allows for bacteria to get in. So we are not a fan of Hibiclens because of the alcohol that's in Hibiclens. It is overly drying your skin. Dove. There is a pH acid balance to your skin. Your skin is supposed to be slightly oily and slightly acidic. That's what keeps that natural moisture, but also protects against bacteria. Dove antibacterial is a pH of 7. It is ruining the acid mantle that's supposed to protect you. Dove also has lots of chemicals in there that will dry out your skin like crazy. So if we are post-op, we have scabs, we have stitches, everything is healing, we are not using antibacterial anymore. We are no longer need to. There is a time and a place in your recovery for these things, and you guys don't really know when to switch your soap, switch your foams, switch your garment, all these things. So your soap is one of those things. When you are dealing with a wound, you're dealing with different phases of wound healing. So in that first homeostasis phase where you're bleeding still is when you need your Dial Dove and Hibiclens. After that, and I would never use Dove if you guys are post-surgery, please don't use Dove. If you're going to use an antibacterial, please use Dial or Hibiclens. Do not use Dove. But if you are still like leaking, you still have that stuff going on, there's no scab yet, use the antibacterial. Thereafter, you need to switch to a soap. Gentle Cleanser. Ours is made specifically for plastic surgery to combat the post-op itch. It's got aloe in it to help get rid of the surgery markings from the marker, as well as help clean your steri strips, as well as get off any adhesive from your body that's sticking, as well as making sure that your wounds are not over dry so they heal properly. Because the other problem that you guys run into is you'll have a scab, but it'll be really thick and really angry and like chunky and dry. Even your stitches, I see this a lot with dissolvable stitches. You will have like a scab over your dissolvable stitch, and that scab is so thick and dry. Anytime you take your garment off, it's getting caught on there. So we want to prevent that from even happening. If your skin is also over drying, your dissolvable stitch will not dissolve as fast. It will take a lot longer to dissolve because your skin is super dry. If you have steri strips, those steri strips will take really, really, really long to fall off because that adhesive is sticking so hard to your skin because your skin is so dry. So we want to avoid the antibacterial stuff after our incisions have closed. With a scab, with skin, after there's no hole anymore, we don't want to be using antibacterial. Because the other thing is you guys are using it all over your body, and your body is in a garment. So you're not just using it on your incisions where it would be like an open incision. You're using it on healthy skin, and you're overly drying that healthy skin. One thing that I see a lot is garment burn. So this stuff helps get rid of garment burn and prevent it. But garment burn is basically where the material of the garment or the friction of the garment, because your skin is so dry, it creates like a friction burn on your skin. There is a difference between lipo burn from a cannula during surgery that happens immediately after surgery versus garment burn that's happening around like week 2, week 1, week 3, throughout your recovery. You're noticing that your skin like really hurts and there's like a burn line or like a crease that's happening. It's because your skin is way too dry and the friction from the garment is cutting into your skin. And because that skin is already compromised, it's creating a burn, a friction burn, like a rope burn basically. So you need to switch your soap. Once you have scabs, once your incisions are closed, switch your soap. Stop using the antibacterial stuff because it's causing all of these issues. So, a couple other things. I have a little bit of notes here. So, the pH balance of your skin is supposed to be acidic. You have naturally like oils that are natural on your skin, as well as bacteria that is natural on your skin. That's good, healthy bacteria. That's meant to fight infection. If you are constantly using that antibacterial soap all over your body, you're ruining the acid mantle of your body. You're taking away those natural oils that are supposed to be there, and that can then lead to an infection. Yes, it can. I know a lot of people are like, how is that possible? It can, because your skin is also swollen, right? So let's look at this real quick. This is your skin on a normal day. This is the swelling. Stretching the skin, making it thinner, compromising the integrity of your skin. Then you're overly drying it out. Any little thing that rubs up against here, any little cut, anything like that is going to break the skin. On some level, your skin has multiple levels. So whether it be superficial, where your skin is just like hurts and is flaking all the time, or if it's an actual garment burn situation, your skin is going to break and be peeling and flaking and cracking and hurt because you're overly drying it, but you also have all that pressure behind it already compromising the integrity from the swelling. Now let's talk about your incision. The skin around your incision. The cut itself is not what makes a scar. It's the abuse to the skin around it that creates a dark scar. So in my wound care video on our post-op shop, I show you guys this scar about a year ago, right? That used to be really big and really raised and really crazy. And I used our soap and the wound care, and now it's a tiny little scar. If you guys are interested in seeing it, go to the wound care video on our post-op shop, and you'll see what it looked like when I first started treating it, right? And this is just a year. So this probably started looking like this, I'd say, at like month 2, and it's been like that since, and it just lightened since since then it keeps lightening. But this white line is the actual scar. This little bit of darkness around it, like barely that you can see, is because it's on my wrist. It's the abuse to the skin around it that causes that little bit of darkness. So if while your skin is healing, you are overly drying the skin around it, and that is already an area that has swelling and pressure, you're going to create a scar. So using Dial Dove and Hibiclens constantly when your wounds are trying to heal is going to damage the integrity of the skin around the incision. If your incision is looking flaky and dry, if you can see the skin peeling back from your incision, you need to change your soap. If your scabs are not flat and very good integrity and just on your skin, part of your skin, if they are chunky and thick and raised, your scab itself, you need to change your soap. Now let's talk about steri strips. Steri strips are the white tape that they put on your incision after a tummy tuck or a breast augmentation. Steri strips are meant to peel off naturally. You're not meant to pull them off. Sometimes your surgeon will remove them and put new ones on, but they're meant to come off of the body on their own. If your skin is super dry from the antibacterial soap, right? Or if you're washing your body with antibacterial soap and you have steri strips, you are causing the adhesive on that steri strip to stick to your skin 10 times stronger because it's got a drier surface for that adhesive to stick to and bind to. How steri strips work, how they fall off naturally. When you have that incision line, you'll notice a little bit of blood on your steri strip, right? Underneath the incision, underneath the strip from the incision. That's the scab that's stuck to your skin. So here's the scab. It's stuck to your skin and it's also stuck to the steri strip. So as it heals back here on your skin and the scab starts to lift off, the tape is supposed to lift off with it because the adhesive isn't going to stay that long. If you are overly drying it, you are going to continue sticking that adhesive there. So even if you're healed under there, your strips will still be stuck to your body like a month and a half out. So using this, the aloe helps with the adhesive, but it also helps with the moisturizing of your skin. So you stop flaking. This will stop the flaking. The aloe helps make sure that your steri strips are clean. So this stuff comes out as a foam. I'll show you in a second, but it comes out as a foam, right? So if you have steri strips and you want them off faster, or they're taking a really long time to come off, or they look gross, like really bad, because the one thing that antibacterial soap does not do is clean very well. It disinfects, but as far as the actual cleaning part, your steri strips will still look kind of gross. So if your steri strips have all that dried blood on them, they're looking really brown or really yellow, take this soap, pump it onto your steri strips and just pat it in. After a couple uses, your steri strips will be super, super white and nice and clean, and you'll see it, and they'll even start to lift. As they start to lift, you don't want to pull them, but you also don't want them snagging on anything. So if you start to see big pieces of your steri strip lift off, you just want to take an eyebrow scissor or a tiny scissor and just snip the piece that's hanging off of your body so it doesn't get caught on anything, because the adhesive on that tape will get caught on your foams and your garment, and you go to take it off and it pulls. It's the last thing we want because it's still healing under there. So making sure that we're trimming those, obviously talk to your surgeon about that first, right? If you start to see them lift, ask your surgeon. If you can't ask your surgeon, that's a different story. But making sure that we're trimming those ends so that they don't stick on anything is super, super important. And making sure you're using a soap that helps actually clean. Because guys, under that steri strip, you have a wound. So this stuff is still going to make sure that that wound is healing and that skin stays nice and moisturized and has its integrity and isn't overly dried, so that when that tape does come off, it's a healed thin line. It's not really dark and flaky and crazy, because I see that a lot too, is you guys will get your steri strips off or your surgeon will take it off and the skin underneath is peeling in layers and compromised because it was getting dried out all this time by the Dial Dove and Hibiclens. You had no idea because you couldn't see under there because it was so dirty, and you can't really see through the tape anyway. So really, really good for steri strips, really, really good for treating that friction garment burn, really, really, really good for making sure that your skin isn't flaking and peeling everywhere. Because let's say you are 3 weeks out and you're having, you can see it's dust coming off of your body, all that flaky, flaky, flaky skin, and then you're putting on a garment over that, and you're flaking in your garment, and then you're going about your day, the natural body heat and a little bit of moisture in there, it's going to start breeding bacteria because you're trapping that dead skin, flaky skin in there against your skin, and your skin is already so dry, and all those natural oils and acid mantle isn't there, and then you've got moisture from walking around in your garment all day, just normal sweat. That's going to be a breeding ground for bacteria. So we want to make sure that we don't have flaky, crazy, tight, itchy, insane skin. If you have incisions that are still like scabs, right? And there's like that, it's kind of like when the scab is flat, but it's like chunky hanging off of your body. You're going to take the soap, you're going to pump it right on there. You're just going to pat it and leave it. The other really good thing I like about this, because that's going to help. The other thing I like about this is the foaming itself. So a lot of times when you guys, and this is why I say this for like that chunky thing, because a lot of times that will happen with the incisions getting really like thick and crunchy, is when you have that dissolvable stitch. If your stitches are taking a really long time to dissolve, or you notice that around your incision where the lipo was done, where that stitch is, the skin around it is starting to peel back and is starting to get really flaky and really dry, start using this. Because the dissolvable stitches, if your skin is super dry like that, will take twice as long. And back to what I was saying. The reason I really like this is it comes out as a foam. We have like a special pump for our soap, where I'll show you in a second. It's a foam, and as the foam sits on there and just does its normal thing as soap, it's working away at all of, first of all, the bad stuff that could possibly be sitting on your skin. Second of all, it's debriding, which is like where it gets rid of all the excess. It's making sure that all of that goes back to being flat and smooth. So the same thing with your steri strips, how it's cleaning the steri strip. It's going to clean where your incisions are, where that chunky stuff is, and it's going to help that fall off and go away. With the aloe is also going to help soothe your incisions. If your incisions hurt and are dry and are angry, the aloe is going to help a lot with that, because there's aloe in here, there's grapeseed extract in here, and there is arnica in here. Now, for the bruising, this stuff is amazing for the bruising because of the arnica in it. What is also amazing is our extra strength post-op cream with arnica, because most arnica creams have just one, the Mexican arnica plant in it. Ours has two. Arnica is a daisy. We have the American and the Mexican in our cream, so that helps a lot with bruising. But this soap also helps a lot with the inflammation. It calms the skin. So if you guys are having like angry, itchy, painful, dry, like your skin really hurts, this stuff helps a lot with that because of the arnica. The aloe also helps get rid of those lines after surgery, the Sharpie lines, because a lot of times it is Sharpie. If you guys are using Dial Dove and Hibiclens, it is, and it's the same thing with adhesive. You guys will hear online in these surgery groups, use baby oil, use baby oil. I would not suggest putting baby oil on yourself after plastic surgery, just saying. But the aloe helps to get rid of those lines. They'll come off in about a week and a half just from using our soap like twice a day. Also, any sticky adhesives. So that goes for your steri strips, but also sometimes when they have gauze on you after surgery, you still have that sticky stuff on your skin. This will help get rid of that, like within the first couple washes. So that's pretty much all that's in here. We have like only a handful of ingredients. It's all natural, it's dye free, it's oil free, it's fragrance free, it's free of pesticides like Dial. It's pH balancing, which is really, really, really important. Super, super important is it maintains the pH balance of your skin. It keeps you hydrated. Guys, if you have flaky skin, no amount of moisturizer you are going to be using is going to help with that, because the minute you go and shower, you are over drying your skin again. We have to stop the process of the over drying to begin with, so that this can start healing itself, and your skin can start to get healthy again. But you guys are in that garment 24/7, and you're using this really drying antibacterial stuff constantly. I mean, for weeks you guys are using this. Also, delicate, important parts, like, you know, down there and up here, we shouldn't be using that stuff on. Just side note, should not be using that in any of the delicate places. This stuff is gentle and good for those places, but Dial Dove and Hibiclens are not. So if you are going to be using that for your first, week or so, please don't put it in the important parts. I would not suggest that. That is going to cause a massive problem with all of those gentle areas. One of the things that you don't want to have to do is vigorously scrub. When you're using the Dial Dove and Hibiclens, they come out as like a gel, like a body wash, right? Or Dove is like a bar sometimes. First of all, your skin is swollen. Any vigorous rubbing is going to cause more irritation, inflammation, and swelling. Second of all, you have delicate incisions. Even if we're using the Hibiclens, right, and we're foaming it up in our hands, and then we're doing this, you still have to rub it on. With this stuff, you don't. You just put it on, and it does its thing. So, one handful, one pump. That's it. It's light, it's airy, it bubbles, it does its thing on its own. You don't have to do any of the scrubbing or rubbing. You just pat it on. Now this little bit, right? Look at that. It is so much everywhere. Just that one pump. So you don't need a lot of it. That's why I say per incision, we're just going to do one pump per incision. We're not going to like really like pump it on there. We're just doing one pump per little lipo incision, right? If we have steri strips, we're going to cover the whole thing. And we're just going to pat it on there and leave it. Let it do its thing. So let's do how to use instructions for showering, right? So how do we use this? We go in the shower. First pro tip, after surgery, your shower should never have steam coming out of it, ever. You want a warm shower. If you see steam coming out of that faucet, way too much. So if we can't shower, we'll talk about that in a second. Like if we have drains and we're still not allowed to shower, but all the other incisions are closed and we're okay, we're going to start using this stuff. We'll get to that in a minute. But when we go in the shower, we want it on warm. We don't want to see any steam coming out with the water. You're going to wet yourself. You are then going to take this. You're going to do a pump on each incision. You're going to cover your steri strip. You're going to pat it, and then you're going to leave it. You're not going to wash it off. You're going to leave it. Let the soap do its foamy thing. Let it get in there. Let the arnica treat the area. Let the aloe treat the area. Let all of that stuff get nice and clean. Just pat it on there. Leave it. Let it treat the skin. Then you're going to use this on all the important parts and everywhere else. This is for your face. This is for your body. This is for everywhere. But you want to make sure you're getting your incisions first. So get those incisions first. Let that sit. Let it do its job. And then wash everywhere else, or soap everywhere else. Then you're going to just wash it off. And that's it. You are done. Now, if you cannot get in the shower, right? Let's say your surgeon did not tell you what soap to use at all. We have, we can use whatever soap we want the first time we can shower. Let's say you're going to Sonobello or Elite, right? And they give you 0 instructions for post-op care, like at all. I have 2 videos. If you guys are interested, on my Instagram and on my YouTube, the full videos are on YouTube. One on post-op instructions, what you need to be doing for Elite, and one what you need to be doing for Sonobello. If you are getting any surgery at those places, they don't give you any post-op instructions. So let's say your surgeon didn't tell you what soap to use. Back to the golden rule. If your incisions are closed, you start using our soap. That could be within the first week. That could be within the second week. Whatever it is, you start using our soap. So if you can't take a shower, right? Let's say it's the first time we're allowed to clean, right? Get out of our garment, but not get in the shower. You're going to take a bowl of water, warm, not steam, not hot. You're going to take the most gentle bath towel you could possibly find, like hand towel. You're going to dip it in the water, squeegee it out. You're going to wet the areas. Now, if, let's say, you want to just be clean, right? You can't take a shower yet, but you want to be clean. You can't come out of your garment yet, but you want to be clean. Because sometimes our skin will smell like anesthesia and antibiotics and that medical smell, right? You can do this with your garment on. You can still wash the important parts with your garment on. So, bowl of water, wet the places that you want to wash, whether it be outside, inside the garment, whatever it is. You're going to take that wet washcloth and you're going to pump the soap right onto there. Then you're going to pat it on and just gently wipe it onto your body. Wipe it in, let it do its thing. You're going to take the hand towel, dip it back in the bowl, get it wet, and wipe it off. That's it. Unlike Dial Dove and Hibiclens, you can't do that. This stuff is designed for that reason. You can take a bird bath with this. You can use it for your important parts, and the aloe and arnica is still going to work. It's going to get absorbed into your system. It's going to give you that little bit of a boost, which is good because you can't exactly get it on the areas where you had surgery right now because you're in your garment, but it's still going to work on your body because it's being absorbed by your skin. and it's going to help get that hospital smell off of you. And then again, even if you can get out of your garment, but you can't get under the spray of water in the shower, you can do the same thing. Sit wherever you're going to sit. Do like a bird bath situation on those areas. Use the soap. That way you're clean. Your skin is being treated. You can start working on like the surgery lines, right? That can start coming off. You can make sure that all the skin that's in your garment is still being taken care of. Even if this is not going on incisions, it's for your skin, because we want to make sure that we're taking care of that skin so it's healing properly, so our incisions heal properly. This is the other thing, guys. When you guys are worried about scars, right? And I have a whole video on our wound care where I show you this scar that I had. And this was maybe about a year ago, right? And when I recorded the video, it was like a fresh cut. And I showed you with the wound care how to use it. So using the wound care, I use our soap every day, everywhere, all the time, because I rock climb, and the arnica really, really helps with the soreness, but the aloe also helps keep my skin super hydrated, especially in these winter months that we have here in Jersey. It really does help a lot. I don't have to moisturize 24/7 all the time with heavy, thick lotions for my skin, because I'm not drying my skin out in the shower to begin with. So the arnica really, really helps with the bruising and the soreness for this, but also the inflammation around the incision site. So when this became a scab, I mean, I was using it since I had the cut, but the thing around the incision is what causes the scar. The scar itself is white. It's the darkness around it on my skin that causes the scar to be noticeable. So if we are taking care, when this is a scab, if we're using this to make sure the skin stays hydrated and not over dried, and then using the wound care to help the actual scab and the incision itself heal, we can prevent scars from even happening. Then at 6 months, we can then worry about the scar stuff. Because like I was saying before, guys, wound healing, you have different phases of wound healing. And there is a time for certain things within those phases. So in that first phase where you're bleeding, that's homeostasis. In the second phase, that's inflammation. That's where swelling comes in to start making new tissue. In the third phase, that's proliferation, where all the swelling that's in there is now starting to lay down and become new tissue. All of that is still a wound. It's not an actual scar until it's at 6 months to a year to 2 years. So up until that 6-month mark, we still have a chance to not make the scar to begin with, then to not have to worry about using scar tape and all this craziness. If you guys start using that stuff too soon, you will notice that there will be a purple ring or a red ring around your incision, and your incision will be like wet, kind of. Your skin underneath the scar tape will be wet because it's still a wound. It's not a scar. So use this stuff the first time you are allowed to shower, or when you have scabs and everything is closed. We can stop using this stuff when we are out of our garment and our skin is back to normal integrity, or at like the 3 to 4 month mark. I would continue using this up to 3 to 4 months, because you're still going to be swollen. So that skin is still going to be compromised with all that pressure. We want to still keep treating it. If you are still swollen at like that 4-month mark, either your manual lymphatic drainage isn't working, or your garment's not working, or something's going on. Because around month 3 and 4 is when you should pretty much be healed at that point. Out of the garment, out of the foams, done. Your skin is healed, your incisions are healed, done. So this is why I say at like 4 months, 3 months, then we can, stop. But I would continue using this for the wound healing part of it and keeping that scar area still hydrated and healthy, and the arnica is going to help with the swelling, and the aloe is going to help make sure that it doesn't scar really bad. So starting, around that 1 week mark, all the way up to like your 3 or 4 month mark, I would absolutely suggest doing that. I think that's pretty much it, guys. But if you're having that crazy, insane post-op itch, if your skin is flaking like crazy, you could put on as much moisturizer as you want. It's still going to keep happening because you are over drying your skin with the antibacterial, with the chemicals, with the dyes, with the fragrance, with the pesticides that are in there. And it's gonna slow down your wound healing. There is going to be, actually this week I posted a couple slides explaining how antibacterial soaps dry out your skin and like destroy your incisions and slow down wound healing. There are a bunch of articles online that you can find that explain that it starts to break down the oils in the skin. It starts to break down the skin in general. It's like trying to sew together two pieces of fabric when the ends of the fabric are really frayed. That sewing together is not going to be as good as if you have a nice, thick, strong fabric. If the ends of this are all frayed and like broken apart and you're trying to sew that together, your body's trying to close that wound, that fabric, that skin doesn't have enough integrity to create a nice, strong, flat closure and not scar. It's going to try to lay down proteins and make whatever matrix it can to get that thing closed. And that's how we have ugly scarring, keloid scars, all these different things. It all happens during wound healing. So our soap is in the online shop. You guys can purchase it, Amare Post-Op Shop. The link is in the bio on our Instagram. If you need me, if you are having trouble with wound healing, or if you're getting surgery, or if you're having trouble with your skin after surgery, if you're planning to have surgery, if you need help with a garment, if you need help with your massages, I am located in Highland Park and Elizabeth, New Jersey. But I also offer virtuals for those of you who are not in New Jersey. I can help you, set you up with your products, teach you how to use them, tell you what ones you need to purchase, help you with a garment, talk to you about your massages and your aftercare. I can guide you through this whole process to make sure that you don't have any complications like fibrosis, or really like big pieces of lipo burn, or if you got stuff going on with your skin during the post-op recovery process, I can help you. So you can call our office 732-841-0142. I can help you out with all of that. We also have our online course, post-op lymphatic massage and finding a therapist. If you are really swollen still and you're having trouble finding a massage therapist, I teach you in that course what to look for in a therapist. So you can go on Google and verify credentials and ask questions and find somebody in your area, as well as the therapist directory links to the schools that certify therapists to be manual lymphatic drainage certified. Those are also in there. I teach you how swelling works. I teach you the things that you need to avoid doing during your recovery that's causing more swelling, causing wound healing complications, when to start your massages, what they should feel like, how long you need them for, when you need them throughout the week. All of that stuff is in the course. So that is also on our online shop. You guys can go check that out. And if you are getting the soap, the two other things that you need is the wound care and the post-op cream. Both of those are in our online shop. We have videos on the product pages as well, teaching you how to use them. But that is what we call the Amare trifecta. This is the first step, your soap. Then you treat your incisions and your skin with the wound care, any piece of broken skin, whether it be garment burn or a cut or an incision or dissolvable stitches or whatever it is. Then you use the post-op cream everywhere else. It helps with the numbness that you're having to bring circulation back to the skin and feeling. It helps with fibrosis. It helps with swelling. It helps with the pain that you're feeling from the fibrosis, the numbness, the tingling, the burning, all of that. So the wound care, and the post-op cream is all part of the same treatment system. So guys, this is Ashley with Amare. That's a little bit about our soap, and I will see you guys soon. Remember, please do not scrub away at your body and your incisions. Please be gentle with yourself. Please stop using antibacterial stuff when you are already dry and you don't need to be over drying. And that's it. I will see you guys soon. Ashley with Amare. Bye.